You're welcome once again. Good evening, everyone. I want to welcome you to another Saturday edition of our Health Forum. This is Tabitha Health and Wellness, online platform for women. We teach, we encourage, and we lead women to embrace and practice healthy eating and lifestyle in order to stay strong and healthy so that we can be strong, very, very strong to fulfill our God given purpose on earth. We do not diagnose on this platform, we do not diagnose or treat any diseases. Therefore, if you have any health challenge, do not hesitate to see your healthcare provider or a physician for support. Today, we will continue from where we stopped last week. Last week, we started on this topic of stomach ulcer, and this series started about 2 weeks ago. And thanking God that He's helping us uh, to be able to trash some of these things so that we can be able to embrace the truth and we can navigate through our health situation. Now, we gave a brief illustration last week about stomach ulcer. We talked about the type of ulcers as well. We equally talked about the causes of ulcer as well. So today, let's start with the symptoms of ulcer. Okay, it is important for us to mention this that it is possible for someone to have ulcer and not have the symptoms of ulcer. So this particular situation is called asymptomatic. So you can actually have ulcer, have H. pylori, or because there's no trigger or there's nothing happening within you, or you didn't cause a something to raise an alarm, and then the alarm won't blow out, and so there won't be any symptom at all. So that is what we call asymptomatic. So it's a possibility. Ulcers can cause. We also want to establish that ulcers can cause so many symptoms, a lot of digestive symptoms. It could be mild. Some people experience a very mild one. Some experience a very severe pain. Okay. And if you have seen anyone going through ulcer pain, you will want to have a deeper understanding of what ulcer is all about and pay attention to what we are talking about this particular period. It's such a devastating pain, and you don't pray it for your enemy, actually. Um, so it's something that it can be very severe, yes. And the pain that is associated with ulcer can can be bad, like I said. And so let's look at some of this pain. Some it could be mild and it could be very severe. But let's look at some of them. And sometimes you may just have these things and you don't know what is going on within your body system. It may just be ulcer and it may not be ulcer, it may be other issues. But in whole, it's they are all, it could be linked to digestive health issues. Yours may not be peptic ulcer, it may just be something related or something that is causing problem in that digestive chamber. So the first one is a burning sensation. You have this burning sensation at the stomach side, and then when you have ulcer, most of the time you look towards your right and your left hand side. Sorry, I beg your pardon. Your left hand side, just below the ribs, below your breasts, breast cage, your breast ribs. You see that that's where your stomach is actually located. So if you have sharp pain around that area, is an indication that something is happening there. That's not the only thing. It's not only ulcer that can be associated with that pain, but because there are other organs that are attached to this left side of your body, of the stomach region, and we know we have the pancreas around that side. We also have the left kidney, we have the ribs, we have the spleen around that area as well. So you don't want to just say, oh, it is ulcer. You can't just say that and lay claim that is ulcer, except it is well established. So that's another one. Then we have bloating. Some people just feel bloated. Yeah, either they eat in between them when they're eating in between their meals, after their meals, they just feel bloated. I've had a lot of women reach out, complain about this particular symptom, and a lot of people are having they're having fantastic results. Many, very, very few women still talk about bloating because lifestyle has been able to help in that area. So bleeding when vomiting, that's another one. Can be bleeding when vomiting. I talk about another type of ulcer that can result, that can be bleeding ulcers. Okay, where maybe there's a damage in one of the blood vessels in the stomach. Okay, so but this sometimes, I mean, not be just that, but it's also a symptom if you have that bleeding experience. Nausea or vomiting is another sign. Some people, they feel nauseated, or they even practically start vomiting. Then your stool can be darker. Is another sign, another symptom, another sign. Okay, there are signs and symptoms, so this can be categorized to the sign, because we can say, okay, so loss of appetite is another symptom. You can lose appetite. You can lose appetite and not feel like eating is another one. Then you have trouble sleeping. Some people just have trouble sleeping because there's so much pain, the gassing, and then the pain, the acid is rushing down to the chest region, to the back, and all of that. There's always a problem sleeping, trouble sleeping. Then some other digestive issues can also happen to this category of people. Other digestive problems that can happen are things like acid reflux. You just have this acid reflux. Okay, some people have heartburn. Some people have what's it called, it feeling gassy all the time. You feel gassy. Some other people might feel diarrhea. They might have diarrhea is also another one. Diarrhea might even be another beginning of the sign. Some people just having diarrhea frequently and all of that. You will know, you just feel that maybe you had something, or your stomach, you had vegetables or certain things that you ate that might be causing you to be having diarrhea. It may just be ulcer that is creating that particular ugly situation. Then we could also have dehydration. If you feel highly dehydrated, you feel dehydrated is another problem. Then you have weakness and fatigue. Some people have serious and severe fatigue, or you just feel tired unnecessarily without any reason. You just feel tired, slightly tired, or fatigued, and all of that. That's another problem. Then another one is you also have the risk of a perforation in the stomach, and perforation on the organ lining, and this one can be life threatening in a way, but no, it's not common to all, but then it can happen, and it's happened to some people that it will have to be an emergency situation. That's why we say we do not diagnose, because sometimes some people will reach out to me, what can I use to treat ulcer? And I keep saying to them that I cannot be giving maybe, okay, use this, use that, and all of that. I engage I engage with them, and I said, you know what, let's go through the period of eating healthy, a 30 days challenge. Let's follow that process, and so that we can see what, and then get a diagnosis, proper diagnosis. Then we can now, from there, we can now begin to say, okay, this is the approach that you should use, and all of that. We can generalize all, but some cases may just be much more that you need to handle professionally. Then you also have and that perforation might not be, so sometimes it might require surgery. That means you need to do a repair around that area. So but it's also good to note this, that ulcers can be very painful, yes, but a very large amount of it can be treatable. They are highly treatable, and then it doesn't require surgery and all of that, except it's really a very serious condition, like the perforation of the lining of the organs or something. So that's might require that, but in whole, it doesn't require all of that. Then another thing that we need to also understand is that peptic ulcer can play a significant role in other diseases. That is something that I want us to understand, that you having ulcer can create other problems, and that is the truth. Like, for instance, H. pylori, the bacteria H. pylori, it can create so many problems in the digestive system or diseases and all of that. In fact, as a matter of fact, I was speaking with somebody yesterday, a practitioner, and I was talking to a practitioner not yesterday, you know, sometimes ago, and it was like, the lot of link of link of a high blood pressure to ulcer. That most of the people who have ulcer, who have high blood pressure, most of his clients that have high blood pressure, you when they find when they do further investigation, they realize that they have ulcer. There's always this; it goes hand in hand, and ulcer and high blood pressure. There's also not only high blood pressure, it could be other things as well, because there is an organism that is not meant to be there, and it can be creating problems in your others in the system. In fact, somebody even said to me that the presence of H. pylori can create a lot of problems, like cysts, like fibroid, like so many things. No, so many there's so many factors associated with fibroid. So certain things will just come up, and liver issues, kidney issues, and all that. It may just be because of the presence of ulcer or H. pylori that may be the reason for having such affliction. So I just wanted to note that you may be having certain issues certainly alongside, and you may not know, just say, oh, you have this particular, it might actually be the ulcer that is creating a lot of problems around your body system, digestive system, your organs, and all of that. And it is a possibility, because H. pylori, it can flow into the bloodstream. In the bloodstream, it can go. The blood passes through the liver, passes through the kidney, and it can cause any problem. Your blood passes through your cardiovascular, and the presence of these organisms can create problems wherever they find themselves. So it's a problem. The deposits of them can cause really big problem. So now let's look at diagnosis of stomach ulcer. So how do we want to, what are the treatment plan that we want to look at for you, for us, a more holistic approach, to helping us to work against this particular problem. Holistic approach means a complete approach to this. Not that we just want to alleviate the pain alone. Alleviating the pain is good, okay? Because you can't be in pain and enjoy life. So, but we need to alleviate the pain and also be able to get to the root cause of this problem and check it out. And this particular aspect is not going to be done by anybody. It's a decision that you have to make, because there are certain things that must change from your system, from your approach, from your ways and lifestyle, so that you can enjoy a better life. And if you're not ready to do that, unfortunately, it will be very difficult to achieve to have choose a very beautiful result when it comes to working towards winning the battle against ulcer. So now the first thing we want to look at now, we want to probably boost our immune system. Now, if we are saying H. pylori is one of the culprit for stomach ulcer, then H. pylori would not be there if we can build our immune system. We will not be able to walk, to operate, if we can build our immune system. So we need to build our immune system as much as possible. Uh, how do we build our immune system? We need to build our immune system by supplying it with nutrients, minerals, and all of that that can boost the fight against infection in our body system. And when your immune system drops, that is when the H. pylori can triumph over your body, So we need to cut down on this particular problem. And what are some of the lifestyle problems that we need to call that on? We need to call that on poor lifestyle habits. If you smoke, you need to quit smoking. Drinking high amount of alcohol can be a problem. Eating a poor diet high in processed food, which many people are used to, and that is one of the causes of ulcer. Honestly, that's one of the triggers of ulcer. If we can checkmate this, then we'll be able to triumph over and have victory over ulcer. Then eating a poor diet, okay, that is it. Sedentary lifestyle is another problem that can create problem, surprisingly. because these can help to encourage what inflammation. It can reduce your immune system because you are not moving and there's no proper circulation. When there's no proper circulation, there'll be a problem. So that is where they link with exercising, mild exercising with ulcer treatment. Mild exercise with ulcer treatment. There's problem. There's a good movement, and it can help a whole lot. Okay, then another thing is to you have to remove, or I say remove because I know it is possible to remove them, all of these non-steroidal anti-inflammatory drugs, no NSAID drugs for pain relief. There are 1,001 products out there. They call it for pain relief. All kinds of products, especially ladies or especially young girls who have menstrual issues. They have these small pains, favine or something. Please, it is not one drug that somebody sort of the names that are called this product. Please, you want to do away with them because they can try. Even if you go to the hospital, the doctor will even ask you, do you have ulcer? Why they are asking you? Because they know that certain drugs can trigger the ulcer that's already existing. So they want to be cautious. The kind of drugs that they give you, have understanding about your background before they can offer drugs to you. And if your doctor forgets, you can also remind your doctor that you've had an history. If you know that your ulcer is healing, you can say, oh, I've had an ulcer, I've had a history of ulcer. I hope these drugs will not be. You can also help your doctor to just put a reminder because they have a lot that they are tackling, that they are dealing with. So that's another one. So you need to look for alternative ways to work and to navigate around your this health, the pain that you may be having. So the diagnosis for ulcer differs from one practitioner to another, but the general thing that or general test that you can run to ascertain, you ask the questions, first do investigation, and ask the question about your usage of NSAID, non-steroidal anti-inflammatory drugs. Those drugs they ask you if you a doctor hears that you use this one frequently, you can narrow it down that this might just be hostile. You ask for certain drugs. Once he hears about the drugs, he will know that you may be having ulcer as a result of the drugs. And it's also possible that some of the drugs used for diabetes and all of that, hypertension and all that, it is possible as well that it can create problems for the stomach, in the stomach lining, and the thing can cause a trigger in the in the stomach. And so you want to talk to your doctor. The doctor will ask a question based on your response, based on your feedback to your doctor. Your doctor will now come to a conclusion. Then they run tests for that. They can run a blood test to see if there's H. pylori, and they also can do is two tests to see if there's H. pylori. Some even go ahead to do tests like endoscopy. Endoscopy is like using a kind of a mirror to look through your esophagus to see if there's any kind of impairment or any kind of distortion in that area. Then you can be able to look at it and see if there's any. If I go to your stomach and see what exactly is going on in your stomach region. But before you go to start doing endoscopy, I want to advise that you do other things around you. You run simple tests around before you go ahead and run endoscopy. Let that be the last result before you eventually go to run endoscopy if need be. Okay, so now, so simple tests like that can be used to determine whether you have ulcer or not. Like I said, two tests is another one that can be run to determine if there's H. pylori and all of that. What is important for us in all, and the reason why we are doing this particular class and series is that what is the goal of what is that goal, okay, of treatment for stomach ulcer? What we want to do is that we want to reduce the pain, or we want to reduce the inflammation, okay? And in order to do this, there are so many things that I know that the doctor may have recommended for you. Or over time, we have seen that they give you antacid to reduce maybe, the flow of the acid in your stomach region, okay, which might also be a problem. It could also be a problem because when you have low acid level in your stomach, which is necessary for digestion, then you might have problem again in getting to digest certain kind of food. So you see that can be a problem as well. So then you might also be given certain medication to also help with the pain as well. To douse the pain, they might give you certain things and all of that. That's not why we are here. But the bottom line is that your doctor will want to give you certain medication. But I have noticed that that hasn't worked. That hasn't helped because the rate at which people have ulcer these days have been really, really bad. So that is not bad on its own. It's a palliative measure, okay? Meaning things that will help to alleviate the pain, okay, contend with that pain so that you will be able to live a normal life, okay. But it doesn't say that that will not come, that kind of attack cannot come again. So that's why we are here. We need to know better other ways where we can help our body system to heal properly so that we'll be able to fight against this particular problem, and we will be doing that shortly. Another thing is to manage stress. Imagine how stress has a whole lot of contribution to our healing. Managing stress has a whole lot to do to heal from ulcer. Chronic stress, minor stress is something that you want to work against. You see, stress has a way of affecting our brain. That is the brain, that's what they call your digestive system as the second brain. So you must know that there is a powerful connection between the brain and the digestive system. In fact, they work hand in hand. That's why it's called second brain. So you must be careful the kind of thing that you do. Now, your activity sends a signal to your brain, and when the brain sees that something is happening, what do you think will happen? There will be a signal to the second brain, and there will be a distortion. There will be distortion, and then from that alone, you may begin to have problems in your digestive system. Now, that's why many people think that I've been doing everything, I've been eating healthy with all this healthy eating that I'm doing, and yes, I still came that with your stress level may be high, and then you need to work around your stress level. If your stress level is high, the hormone called cortisol hormone will be active in your body, the amount of it will be high, and cortisol, continuous storage of cortisol hormone in your body system, is going to create a problem. It's not an hormone that should be found available, readily available in your body system. It can create problems. So you need to work more on how to manage stress, how to distress. Many times there's so much stress, I know, but we must learn how to distress, because that stress can the stress is capable of creating further problems that will not even allow you to enjoy what you are even laboring over. They will not. What you think you are stressing your body over, just your health, what comes after, will not allow you to even enjoy to enjoy it. So you need to really manage the stress as much as possible. Another thing is to eat a stomach ulcer diet. What do we understand by a stomach ulcer diet? This is something that is very key, and many people don't link these things to ulcer. And it is better for us to begin to think about this as much as we can. All the food that are packaged in those boxes, they are ulcer triggers. All the food that are processed, they are ulcer triggers. Any food that doesn't have life inside, they are ulcer triggers. Any food that can cause inflammation, they are also ulcer triggers. So you must ensure that you take away all of these things. Another thing that you must avoid to do is also to eat too heavy meals at a time. Though they are health, they are good, but your food shouldn't be over, should your stomach shouldn't be too full, extremely full, that there will be problems in digestion, there will be discomfort, you can begin to have bloating issues and all of that. So amount of food that you eat is also a particular thing, something that you must pay attention to at as well. So let us look at some of the things that we think can worsen the ulcer symptoms. This particular aspect is not peculiar to everybody, okay? It's only peculiar to certain category of people. So please don't get me wrong. And some are, they cause problems for practically everyone, but not everybody can have problems with some of the food that I'll be mentioning. Now, we have sometimes a black pepper can be a problem, okay, and it can also be a blessing to other people. Some people say red hot pepper can affect them, can trigger them. They say spicy food, but school of thought also have it at cayenne pepper, and some of this pepper they are also very good for ulcer, but with caution, okay, with caution. Then caffeine can also trigger the ulcer symptoms. Um, what you call it, some alcohol, of course alcohol is also a problem. Citrus fruits, I always caution with this particular one, the oranges, the lime, the lemon, and then some of the juices that have citrus, high citrus content, they can be a problem. Of course fatty food can also be a problem. Fatty food, fried food, they are triggers. Oh, so tomatoes too can also be a problem for some people. Onions may be a problem for some people as well. Peppermint too can be a problem for some people as well. So you want to check with what exactly are your triggers at any point in time. There are some foods that are called irritants. They just irritate the stomach lining, they irritate the digestive system. You want to avoid such irritant. One of the very common irritants that people don't pay attention to is dairy products. You want to be careful on dairy products. So you want to go on with what they call an alternative to dairy product. All the plant products, uh, uh, plant milk, they are best bet for you. They are very high in nutrients. They are high in nutrients. They are lighter. They don't cause irritation in your digestive wall, except you have any peculiar issue with any of those plant products. Now, if you have if you have eating certain things and you notice that you always feel irritated, it is wise that you stay away from that food, or leave that food for a while, then resume back to it. Watch your body again, and then see if that is the same thing that caused the trigger. Then if, because sometimes the combination of different food, you may not be able to lay hold on the particular thing that caused the trigger for you. So but if you want to judge, could it be the milk, could it be this, so you can change it different times to ascertain. And that's how to do, because here in this part of the world we may not have that particular thing, although we have, some people have the diagnosis kit where you check for allergies. Yes, they check for allergies, you can do that, and you check for what you are allergic to. Very available, very much available here in among the practitioners, some practitioners as well. So you want to check for gluten products is another irritant. Gluten products are another irritant. Be careful the kind of food that you are consuming. Gluten products can be a problem as well for a lot of people, and you want to as much as possible to avoid that. And then if you indulge in alcohol, you have also, you are complicating your issues. You just want to stay away from that. Stay away from smoking and all of that. Eat smaller meals at a time. I've explained this. I can't overemphasize on this. Eat smaller meals of the time throughout the day. Make sure you cut down on your meal plan. You know what we say on our healthy eating lifestyle here in Tabita. So then you want to also avoid eating too much of hot. We can burn your esophagus. Your esophagus, when you eat too much of oatmeal and you eat too fast, it can be a problem as well. It can cause a trigger, it can cause a problem. So if you want to drink your tea, don't make it overly hot. that the thing is steaming very well and it's burning your mouth. No, please let it simmer a bit. Then before you just take a sip at a time and then manage things like that. Then make sure as much as possible you eat before 3 hours at least before your bedtime, so that your stomach is empty. Your stomach is practically empty, not completely empty that way, that it has fully digested before before you finally go to bed. It is very crucial to pay attention to these simple details concerning our health. There are certain practices that always encourage people that have ulcer to check out. Okay, and I will be mentioning some of them. I've explained to some people that certain food help your ulcer. The first one I like to talk about is the cabbage juice and carrot juice. If you feel irritated with cabbage juice, you can douse it with carrots. So it's like 50% of your carrot juice and 50% of what or cabbage juice. You can take that about 3 times a day. 3 times a day. It helps to cool down your stomach lining. Cucumber juice and cucumber juice is another wonderful one. Cucumber and carrot is also another wonderful one. You can also help you to soothe your stomach lining. One other thing that you also want to do, you want to enjoy with coconut oil is also very powerful. It's a beautiful product that you can take 1 teaspoon. Take 1 teaspoon like that. Maybe in the morning. It's also a fantastic way to help with your ulcer. Cayenne pepper is also very nice for ulcer, but you want to take precaution. Maybe you can sprinkle over your food and eat it. Please do it little at a time. If you react to pepper, please stay away from this. Okay, start little if you want to try it. If you want to give it a shot by yourself, please know that you are by yourself, your own. But you can research on it. Cayenne pepper has been found to be very effective on H. pylori particularly. Then you can also do, of course, you can also do activated charcoal. 3 tablespoons of activated charcoal in original honey, 75 ml of original honey. Mix it together and it can be taken as a sip. Every 2 hours, you can also do black seed oil and coconut and then organic or natural honey. Mix it together. Every 2 hours, you can also be licking it, or 3 times a day. That should be okay for you. You equally want to look at hydration. Dehydration can be a problem, especially for people who vomit, who have nausea issues. It can be a problem. So if you do less water, you don't hydrate your body, it can also affect the electrolyte level in your body system, and that can be a problem. Then if you vomit as well, you don't take enough water, you further dehydrate your body system, and it can lead to a collapse. It can lead to a collapse, yes. So please, you want to be careful that you don't allow yourself to be dehydrated, especially for people who are vomiting issues with their ulcer symptoms. You want to be very careful. Then it's also important to know that when you overeat, it can also cause burning sensation. So you must avoid such. Don't overeat, don't overload your stomach. It can also eat little if you feel hungry. So eat little quantity. This is my approach. Eat little quantity at a time. You can now even eat it, few times a day, but eat little quantity at a time. Don't let your stomach be too full. Like, we have a pattern of eating. You know the pattern of eating when you eat your salad before you eat your meal. So a lot of people have asked me, I have ulcer, can I do 30 days challenge? So I'll be like, what stops you from doing 30 days challenge if you have ulcer? Because you think that, oh, you are not eating during 30 days challenge, and that's not correct. You are eating. In fact, that's one of the best way to help your ulcer, because you are eating a lot of good fruits. For instance, pawpaw. You have a pawpaw for breakfast, for instance. What you are doing to your body is that you are supplying your body with minerals and vitamins, and those are the things that your stomach need to thrive with. If they don't have that, if there's deficiency in certain minerals and certain vitamins, then there is going to be a trigger or a breakdown, okay, as a result of the pain or burning sensation. But if you eat food like that, You eat a lot of fruits, not citrus food, please. If you have ulcer, you need to avoid citrus food, pineapple, oranges, lime, lemon, and all of that. There are other fruits too that are very abundant in nutrients that are not citrus food. So you want to pay attention to that, please. It's very, very important that we do that. Another thing that I also want us to pay attention to about the food. So if you do that this challenge, it's one of the ways I will advise you to do that. You eat salad. When you eat your salad as well, this template of eating help you to just pump in a lot of nutrients into your body system, which you need to fight the battle against ulcer. Then other things that you also need to do in order to help with your ulcer is to maintain a healthy weight. See, if you if you don't have good your normal BMI, you're going to have a problem with ulcer. Yes, because there is so much pressure when you are overweight. There's pressure around your around waistline, and you know that's where the stomach and every other organs responsible for digestion are located. So when you are pressed down, you overload your body with the kind of food that we have here in Africa, parts of Africa. You load it with so much calories, so much carbohydrates and all of that. Then there will be pressure. The pressure can also create an imbalance in your stomach. So you need to make sure that you are not pressurizing your stomach by overeating. It is not so much of, I've trained my mind to know that even when you are hungry, it is not so much of the food, plenty food that you eat that keeps you up, keeps you going. It is the much nutrient inside the food that actually keeps you going. You can eat a whole lot of bowl of heavy food. You just feel heavy for nothing. You feel heavy for nothing. You don't have the strength and the stamina to chase or to fight, or to energy level in you is very, very limited because you have overheating. You have so much, a lot of calorie, but empty nutrients. So what's the point of eating so large, eating huge, and then you don't have the essential nutrients that helps you to thrive, and have to have excess energy to do all that you want to do. So we need to create is a change of mindset to say that we want to eat uh, nutrient dense food and not just eat a high level of food. So it is important to pay attention to that aspect as well. And the other thing I also want us to pay attention to is to exercise. You can exercise. Mild exercise is also very critical. You know, when we were talking earlier, we talked about the connection between your exercise and moving your body system. You know, when you exercise, you encourage good circulation. Your oxygen moves very well within all over part of your body, and oxygen is nutrient, oxygen is strength, oxygen is energy as well. So it's important that you maintain that mind. It's very simple exercises, like 3 to 4 times a day is amazing. You don't have to go and do all the 1 hour jogging and walking because you are not going for any Olympics. So you have to slow down on that. On a final note, all of the same final note, final thoughts for tonight. Ulcer can be healed. Ulcer doesn't require a gymnastic approach or a fire brigade approach. Take this and this, all of those things that we are hearing on the internet, on a Google. That is not, it's like a magic, it's not a magic that happens. It's not a miracle alone that happens. The miracle that helps you is found in what God has created around you. Miracle happens when you trust God and you're obedient to God. Okay? And then you do that and do what He is asking you to do. Once you do that, you will find out that the Word of God and the confident assurance that you have in God will be manifesting in your health. Don't walk in ignorance and don't walk in disobedience, and ask God to rain His blessings on us. Now that you know, avoid all the avoidables when it comes to creating stomach ulcer in the first place. All processed food and all of that can cause problems for us. Some people say, they will say, you have ulcer. Oh, don't you eat? Some people will be like, it's because you don't eat, that's why you have ulcer. That's not true. If you don't eat, it can be a trigger to ulcer. That is the thing. It's not that it is not eating that causes your ulcer. Please work on that very, very carefully. And then if you have children we already are having ulcer issues, please, you want to work on that. Work on their diet, work on their nutrition, work on their lifestyle. That will go a long way. And then if you have been treating your ulcer in a natural way, or you've been eating healthy and you still have some symptoms, please, I want to encourage you. Please don't give up, because it's a sore and it can take time to heal. And then why the sore is healing, there can be a trigger in between just by some other things that you may have maybe engaging in that you may not know. One of them is stress. Stress that you go through also can also trigger and cause a problem for and cause an attack again, over again. So please give yourself time, encourage yourself, keep doing what you're doing. You're doing the right thing, and then you will have victory. So if you are doing and still having some few symptoms here and there, intensify in what you're doing. Keep praying. Don't forget your cabbage juice is a very good one. Research has shown amazing result on ulcer. On ulcer, please, you want to indulge in. And if you don't have a juicer, you don't have a blender, you can make sure that you are eating cabbage maybe like about 5 to 6 times a day. But if you have a juicer, that's an excellent way to ingest your cabbage. The powerful nutrient vitamin that is present in ulcer in cabbage called vitamin U has been shown to have a tremendous, almost miraculous eating power on stomach ulcer or peptic ulcer. So you want to take advantage of that. I'm trusting God that you will have victory, you will have testimony, and I'm hoping and trusting God as well that this teaching will impact your health as you practice many of the things that we've talked about here. I want you to know, to stay strong, that your healing is just right at the corner. I wanted to share this message with other people, encourage them as well to do the same thing. Don't look for a fire brigade approach to deal with your ulcer. Start from, let's be a realistic approach. Change what you need to change, correct what you need to correct, embrace what you need to embrace, and then victory will be yours. Try some of the recipes that I've given to you alongside with a change of diet and your practice, your healthy living practices as well. Join the 30 days challenge program for the next month if you want to know more. I will be teaching very significantly. There's a different approach to our 30 days challenge orientation class. I'll be teaching and be talking about specific health issues that things they can do concerning their health. I look forward to your testimony. Thank you so much for having me in your corner. God bless you.